Any suggestions you have, Sharon, for a mom who's returning to work and she's breastfeeding? It'll make that transition a little bit easier for her.
First thing is get connected with a lactation consultant and a support group,
Okay.
because you're going through another whole set of transitions and adjustments.
Yeah.
And those adjustments, some women describe them as just as challenging as having the baby and getting breastfeeding initiated. So again, be patient with yourself, be patient with the baby.
Okay.
In terms of breastfeeding, though, I strongly recommend that 2 to 3 weeks before a mom returns to work, she add a pumping routine to her day.
Okay.
So that a couple of times in the morning she is pumping her milk just to store it.
Okay.
And by stocking the freezer in those last 2 to 3 weeks before you go back to work, you have your safety net.
Okay.
We expect your supply is going to dip a little bit that first week back at work when things are a little stressful and routines are all changing, and you may feel a little ambivalent about leaving your baby.
Right.
So at least if you feel like, yes, I have to return to work, I have some separation from my baby, but I'm leaving my milk. Sometimes that helps us feel a little bit better about the situation.
Right, right.
And I also don't want moms to be under the stress of what I pump today at work is what my baby gets to eat tomorrow.
Okay.
That's a huge amount of stress. So again, that 2 to 3 week before that return to work, take that time, do the extra pumping so that you have that milk stored for your baby.
Okay.
And then when the supply dips, you can say, yes, I anticipated this would happen, but I have plan B waiting at home in the freezer.
Now, you had recommended as well, I've heard you talk about trying to find your daycare provider set up close to your work, so you might even on your lunch break be able to nurse
Yes.
at that time.
I find that that's a wonderful thing. If moms are able to work that out, that really does help your own feelings of missing the baby. You only have to get through half of your work day, and then you get to go spend some time with your baby. Nurse, your baby will remove more milk from the breast than your pump is able to, generally speaking.
Okay.
And so you'll feel a little bit better physically, and you may be able to go back to the work with a sense of happiness that you'll get to see your baby again at the end of the work day.
Wonderful. Thank you.